getting actively involved in the work they do.
A new pilot scheme in King's Lynn has been commissioned to help house homeless young people with mental health and addiction problems.
The reason that the Purfleet Trust was selected for this project is because obviously they have a lot of experience and expertise in this field. I think it's projects like this that we can really learn from in terms of what we actually need on the ground and how we can meet the sort of the needs of people who often fall through the gaps of mainstream services.
There needs to be lots more projects like this because there's more. Until I worked for the Purfleet Trust, I didn't even realise myself how many people, how many vulnerable people there were out there, how many, like alcoholics, homeless, drug users. You don't realise until you work in this field, how extreme these cases are.
Well, I've been off the alcohol now for quite a while, and the drugs. I'd just stayed on them really. I'd just gone down that road of just being like quite a few other people, just drugs in societies, they've been called, haven't they? And I wouldn't want to be like that. I mean, my drink was spiked about 3 years ago, and I fell asleep on my arm, cut the circulation off. I've had operation after operation, nothing's worked.
They're discussing amputation, but they're going to try and leave his elbow joint because he's got a lot of tissue around there. So leave the elbow joint, so when he has a prosthetic, he'll be able to...
It's given me so much hope, and I've got hope now. I've got a future now.
By me working with them and kind of keeping them at a level and trying to house them, I'm not just making it a better life for them, I'm making it better, like I said, for the community.
Looking at the public purse, we know how much it costs to keep someone in prison for a year. We know how much it costs when people continually present at accident and emergency services, for example. And I think when you do the sums, this is a very low-cost project, bringing in significant levels of support, which actually do move those people away from those, what I would call primary services and emergency services, and actually spending sort of short-term and long-term periods in prison.
So if we work much more closely together, we have a much better chance of making sure the patient gets the right care first time, but also delivered in a way which doesn't waste taxpayers' money.